Over 20 years of progress gone. Canada has lost its measles-free designation. The Pan American Health Organization first broke the news today following what public health have called a large multi-jurisdictional outbreak of measles that began last year. Roger Collins joins us live in studio with the latest. Roger?
Manisa, this all goes back to an outbreak that began in October of 2024 in New Brunswick that has since spread to the entire nation and has persisted for more than 12 months, predominantly right here in Ontario.
It's the most contagious virus we know of. It's incredibly contagious, and it's so contagious that you can walk through a room where someone who has had measles was breathing 2 hours ago and get measles.
Canada, once hailed for being measles-free, has lost its elimination status.
It's the first measles-related death in the province in more than 10 years.
The measles obviously are concerning, and the public health units that are specifically being impacted, we're offering additional assistance.
Certain communities in Ontario, for religious reasons, are not getting their kids vaccinated.
Today, the Public Health Agency of Canada has announced that the nation lost its measles elimination status, a title it held for over 2 decades.
Well, it's very upsetting because when you look at the other countries on the list of countries where measles is endemic, it's countries that have been torn apart by war, by civil unrest, not countries that have incredible public health and healthcare systems.
The Pan American Health Organization says it has monitored a strain of the virus as having a, quote, sustained track of transmission across the country for more than a year.
Reporting that we've had is that there was a wedding in New Brunswick where someone brought it from part of the world that has measles, and then as people dispersed from the wedding and went back to Ontario, that's sort of what seeded this province.
As of this year, there have been 5,162 confirmed cases of the virus across the country. Ontario head of the pack with over 2,000, Alberta trailing just behind. And experts say it's a perfect storm.
There were many things that happened to get to us to the point that we are now. So, for example, our family doctor crisis is a big contributor. We did have the disruption of the pandemic, so many people fell out of schedule and didn't catch up with that. And there is a bit of distrust that's been sowed against vaccinations in the context of COVID vaccines. However, it would be unfair to completely blame this on misinformation because there are many, many different systems that fell apart at the same time.
Government figures say 89% of all measles cases in the country are in those who haven't been vaccinated. Measles was once considered a childhood rite of passage. It's a respiratory virus which causes fever, cough, and a distinct blotchy red rash. But it's far from harmless and can cause pneumonia, brain swelling, and even death. The first measles vaccine was developed in 1963, and by the 1990s, mass immunization campaigns around the world had driven cases down by more than 90%. And in 1998, Canada declared measles eliminated, meaning there was no longer continuous spread inside the country.
To get it back, we need to invest big time. When we need to make some expensive choices, we need to invest in public health. We need to work on a national vaccine registry so we can all figure out when we were vaccinated and with what. We need to make sure that communities feel heard and have their concerns listened to. We have to work on the family health crisis, and we probably have to tighten up our exemption rules to make sure that only people with medical exemptions or deeply felt religious convictions are not vaccinated for measles.
All the while, the USA and Mexico remain on track to lose their elimination status too.
Are you recommending the measles vaccine or not?
What I've said and what I said,
It doesn't sound like you are. If that's,
are you going to let me answer? Are you going to keep it?
Are you or are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have.
For Canada to officially regain its elimination status, the current ongoing outbreak and the associated strain need to be interrupted for at least 12 months.